Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised. Well, welcome back, everybody, to another awesome episode of the Birth Squad. I'm very excited about our guest today. She is a OBGYN by trade, but has a very specific specialty that focuses on sexual health, which is a very important topic that we don't often talk enough about. So I want to welcome our next birth warrior, Dr. Brandye Manigat Wilson, to the show. Welcome, Brandye.
Thank you. I'm so excited to be here.
We are excited to have you. So I want to start us off by talking about you introducing yourself to everybody and then kind of talking about what it is that you do for a living.
Okay. Well, like you said, I'm Dr. Brandye. I am a board certified OBGYN. 9 to 5 is OBGYN. I still deliver babies and all the things, but also an author, a speaker, and what I have kind of put together as being a life coach for women when it comes to sex and pleasure. And literally what I do is teach women how to reconnect with their passion, their excitement, their desire, so that they feel sexy again and they want to have sex. They want it again. So that's in a nutshell what I do. I just give women space and place and permission to enjoy their lives in general, but specifically enjoy sex.
Now, can you tell us a little bit more about the specialization of sexual health? And then what made you kind of focus on this particular topic for your medical career?
Well, you know what? It actually didn't start with the medical side of it. It started in my personal life. I struggled with low libido. It started pretty early, 26, 27. Like, and I was like, okay, what's going on? Like, I thought I liked sex at some point, and it just became a struggle. Like, I had been in residency, had a big change in residency, had to go across the country. My husband and my daughter were here, and like she was literally maybe a year and a half in age when I had to do all this transition. Came back, started a practice, my private practice, and just couldn't figure out like, okay, I clicked all the boxes. Why don't I want to have sex? Why am I not enjoying this? Why am I just like, look, give me some sleep. It was always the battle of sleep versus sex. Like, man, give me the sleep. Leave me alone. I can't. And so that started me on this journey of trying to figure out like what's going on because it was a big deal. Like my husband's like, excuse me, hi, sexual being here, love to have sex with you. And I'm like, why are you touching me? Leave me alone. Um, and it really was driving a big wedge between us and to the point where we separated, all kinds of just stuff. And it was like, okay, we got to figure out, like, I got to figure out what is going on. And the specialty, like being an OBGYN, they tell us how to teach people how to get pregnant, how not to get pregnant, and how not to get a sexually transmitted infection. But nobody is really talking about, okay, what does it mean for a woman to experience pleasure? How does she get there? What are the things that she needs to be able to experience that, as opposed to you're just here as a vessel for a baby or for a partner in a heterosexual sexual relationship for them to get pleasure, but you're just the vessel. You don't get any of that. You don't get any benefit from that. And so I started looking at different things, reading books, going to conferences, watching stuff on the internet once it, was really popping that way. And everything was very much like, oh, okay, well, just buy some lingerie or get some candles or set the mood or go on a trip. And it was like, okay, I got a whole drawer full of lingerie, but I don't even want to put it on. So then what? And it just began with me looking and seeing, okay, where's the breakdown? What are the things that I'm thinking, feeling, that are in the way, so to speak, of me actually wanting to do this and enjoying it? And I started developing different practices that just helped me not only to tap into the sexual energy, but just tap into who I was as a woman, and to begin to feel sexy and to begin to appreciate my body, who I was, what made me me, as opposed to what I thought the world wanted to see. And so in my private practice, I was getting a lot of women who were coming in, and they were my age, a little bit older, sometimes a little bit younger, like, hey, can you check my hormones? And it's like, okay, well, why do you want me to check your hormones? It's like, well, I think I'm in menopause. Okay, well, let's talk about it, because you're not typically the age for menopause, but tell me what you're going through. And invariably, it would be, hey, I just don't want to have sex anymore. I don't want it. And my partner is like, I want it, but I don't. And I think I'm in menopause because of that. And so, like, in those moments, I would get super excited because I was like, I know exactly what you're thinking. I know where you've been. And listen, let's talk. And it was like, no, you're not in menopause. That's not what's going on. And here's some education about what you may be experiencing. And then I'm going to give you some homework. And I'll give them a couple things like, do this, do this, do this. Like, and go, and then come back and tell me how it goes. Because there were things that I had done that helped me. And so they would go and then come back and be like, Dr. Brandye, like, you don't even understand what you have done for me. Like, that is amazing. And so as I was having those experiences, it made it so that I didn't feel alone, but it also let me know that there were women out there who needed this kind of help. And so that's how my coaching practice developed with Life Love Libido.
You said around the age of like 26 is when you noticed these symptoms. Was that right after were you postpartum? Was it because you were now a mom and you're raising your kid and you're not getting enough sleep? Like, what do you think contributed to those symptoms? And like,
Mm.
what role did like your birth, right? Because physically, sometimes we have pain with intercourse after we have kids, sometimes without having kids. Was there anything that you can like point to that kind of triggered it? Or was it completely didn't have anything to do with being postpartum or a mother?
Um, I think being postpartum and a mother exacerbated it, because I had some low libido, but it was easier to overcome it without having the child and being sleep deprived even more. So it definitely contributed to that. I also struggled with postpartum depression, so that didn't help in any stretch of the imagination. I had come to realize with everything that I was doing, I also had some adrenal fatigue just from the chronic stress that I was experiencing. So, addressing that, addressing the mental health aspects and the depression, like, really were instrumental in me just having the foundation to then be able to look a little deeper and find out like, okay, like there were times where my husband and I would have a discussion about sex because we're trying to fix it, but can't really get to it. And he would be like, well, I like sex and you don't. And that kind of became the refrain in my head. Like, I just don't like sex. That's what it is. That's why I don't want to do it. But in actuality, like on one of those occasions, I actually took a step back and I was like, well, wait a minute. Do I really not like sex? Is that the truth? And I'm like, no, that's not the truth. I do like sex. I mean, I like how the approach is happening towards sex, but I do like sex. And so that was the epiphany for me to really be like, there's something deeper. There's something else that's happening. And so, circling back to the question, postpartum exacerbated things, but I think there were also some other things that were going on that just the whole picture made it worse.
So you talked a little bit about employing some strategies that kind of got you through those challenges. Do you mind touching on what those particular strategies are that you used?
Yeah, absolutely. So first and foremost was meditation, just taking some time out for me to not be focused on anything. I'm a type A personality, and if you leave me to my own devices, I'll be thinking of all kinds of things. And even though I'm sitting and supposed to be resting, I'm not resting. So meditation is the probably the first and foremost thing that also helped me because it kind of tamped down my autonomic nervous system. So it helped me not to be so vigilant. And so, like, hey, I'm looking for all of the threats and the things that can be happening. Like, it helped me to calm down and be able to just sit. It also helped me to get present when I was having sex because my mind would be running like I need to make this doctor's appointment. I got to get the clothes out the laundry. I got to make dinner. Like all of these things in my head, and it was like, okay, you need to just focus on where you are, present moment. Get into that space. So definitely meditation helped. The second thing that really helped was journaling and going through some questions. And even like one of the primary activities that I give my coaching clients is journaling questions like, hey, I want you to take some time, sit, write out what you are thinking, feeling. Like, what do you like about sex? What don't you like about sex? Like, if I say to you, you are deserving of pleasure, how does that make you feel? Like these are the questions and things that I go through and that I went through myself to be like, okay, well, this is what I'm thinking, this is what I'm feeling. And then just finding moments of pleasure in my everyday life because what's happening outside of the bedroom is totally influencing what's happening inside of the bedroom. And a lot of times, as women, we're doing all these other things for everybody else. And if we take a moment to do something for ourselves, it feels selfish. It feels like, oh, well, we should be doing this for this person or for that person. But no, you got to take time for yourself. And so I started taking time for myself, having a glass of water, just sitting, literally just sitting because I was berating myself for why are you just sitting here? You got this whole like 50 million things on this to-do list. Why are you just sitting? You have things to do. So giving myself permission to just sit, read a book, take a nap. Like I couldn't even take a nap in peace because I was like, I have so much to do. So being giving myself that permission in that space to do things that felt good to me, that filled my love cup. So those are probably the top like three things that you can do that don't cost you any money. You just it's time and effort.
Thank you so much for sharing that. I think that you bring up a really good point in so many ways about how the mind and the body are connected, and just how that can influence how you feel physically as well. So taking that time to process things. And then I think, you bring up a really good point also about showing self-compassion, taking care of yourself, giving yourself a break.
Hmm.
You're working so hard, you've achieved so much already, and oftentimes we are our biggest critic.
I very much am. I'm a Virgo, so I'm my biggest critic.
I feel you. Leos are too.
Hmm. Yes, yes. So yeah, but I mean, the other piece of it too, in terms of the mind-body connection, your brain is actually your biggest sex organ. So if you want to be able to have amazing sex, you can't leave it out. You have to do the things that create more pleasure pathways in your brain and then continue to reinforce those. Because a lot of times, what will happen is women will get into a habit of saying no, and you have to break that habit. And usually, what they'll say is that you don't necessarily take something out, you bring something in. So with that mindset, just bringing something pleasurable in will offset the negative habit that you have.
Can you tell us more about your business? Obviously, we're very excited, and we would love other people to know more about it. But also, like when you're having a session with a client, is it like some of the stuff you talked about are amazing techniques that you employ when you talk to them? Is there anything else you do? Do you invite the partner to participate? And kind of like what does that those sessions kind of look like?
Mhm.
I'm just a little curious.
Right. So the sessions generally are virtual. Um, it's all via Zoom. And we usually start off with some wins. So I ask the client to tell me what went well. And it doesn't have to be related to sex. I just, for your week, what were the things that went well for you? What are you grateful for? And I think that just sets the tone for the rest of the session. And then we begin to, usually I'll begin with just a little bit of teaching because I found that a lot of a lot of the miseducation that we have around sex and pleasure needs to be addressed. And so we start off with a little bit of an educational piece. And then we go into any challenges that they may have had with the homework, because I do assign homework. It's not a lot of homework because ain't nobody got time for that, but you do have homework. And we go through any challenges that they may have with that. Anything that comes up from the teaching, we'll talk about. And then at the end, I give them space to talk about what stood out for them, what was most important in this session that they learned or want to explore more or do more of. And then we give a little bit more homework, give some guidelines for that. And a session typically is anywhere from 40 to 45 minutes once a week. The homework shouldn't take longer than 30 minutes. Unless you're assigned to have sex, then please have an hour or more if you'd like. Um, and then we go from there. So,
That's amazing. So I can imagine that just because of a lot of the taboo that is kind of around sex, some things that people don't necessarily feel comfortable talking about, and then adding on that now someone is having sexual health issues. How do you create a more comfortable, open environment to like discuss such intimate topics?
um, well, one, I I don't think it's totally me. I think it's God who is allowing that space for me to hold for women. And then just listening. Like when I'm listening to a client after they've spoken, I will reflect back what I'm hearing. And so just being able to get them, they're like, thank you. That's exactly what I was thinking. That's exactly what I was feeling. I think that just in general allows for someone to be more comfortable with sharing more vulnerable things. Um, and then I think It's just that I have created this space, this container. Even if, like, I have sessions where I'm just meeting someone who's considering working with me. When we talk, even if we don't end up working together, they're still like, thank you so much for giving me the space to talk about this, because they don't know who to talk to about it. They don't know, like, even as an OBGYN, I have patients who come in and are like, I don't know if I should talk to you about this, but I'm not enjoying sex. And I'm like, you're absolutely supposed to talk to me about this. And as a matter of fact, I'm a sex and pleasure coach. So you really should be talking to me about this. And, just there's that taboo about it. Like, who do I go to? But then there's literally like, who do I go to talk about this? The conversations around sexual health are in the mental health space and not in the typical doctor's office space. And so women just don't know who is available to have those conversations. And so I try to be that one, especially with my like annual exams. That's one of my questions. Are you enjoying sex? Are you having any challenges around sex and pleasure for you? So it's important for me, and I think between my own experience, being intentional about it, and God bringing that person to me and giving us that bubble to work within is is how we create that space.
I think it's hard to like you're right, we're not trained. We're taught, men, women, or both, right? Like we're taught to ask that question, but
Hmm.
not everybody is comfortable discussing that with patients. And I think some providers are relieved if issues around sex don't come up because they don't know what to do with it, what resources to provide, how to treat it.
Absolutely.
Because sexual dysfunction is so multifactorial, right? Mental health affects it, other comorbidities affect it, medication affects it. And so it's not an easy fix. So it is a very hard discussion that a lot of people don't want to have. And there are a lot of, concerns and misconceptions that flourish about, And so you've kind of touched on some of them, but I'm curious if you have any other ones that you like commonly see, like any misconceptions or common concerns. And what do you tell people? And it doesn't have
Mhm.
to be, that we're the birth squad. It doesn't have to be around like birth, like pregnancy and postpartum, but just in general, like what are some big topics that you continually see in your
Mhm.
visits with clients?
Fatigue, overscheduling is the number one thing. Secondly, is just this idea that sex is not supposed to be pleasurable for you as a woman. This idea that over time, sex is supposed to die off and you're just supposed to be comfortable holding hands and cuddling, but not having a vibrant sex life into menopause. That menopause is that it's the death of your sex life. Like, there's so many things that get mm, engendered in us as we age and as we grow up. Like, even just this idea that, for me and my faith, like, abstinence is before marriage is supposed to be the thing. But then once you get married, like, the shackles are supposed to come off and you're supposed to be hanging from the chandeliers. How do you make that jump? How do you make that transition? All this time you've been told you're supposed to say, no, don't, I can't. And now you're supposed to be like, oh, okay, I'm free, let's do it. Like, that's not an easy transition for everybody to make. So there's so many different things that come up with women, but I think those are some of the top things. There's also relational issues, like if there's resentment, bitterness, hardness of heart, like all of the things, you are less likely to feel connected to your partner and to want to have sex with them. So you got to deal with those things. If you are bored, a lot of women are just bored. They're like, we do the same thing over and over again. And I need some variety. I need something different. So there, so many categories of things for why women are struggling in this area.
For sure. And I think you touched on it a little bit about how, some people might be taught abstinence and then, swinging from the chandeliers after you're married, right? So there's a lot of cultural and societal attitudes about sex. How do you kind of navigate that? Because it could be a touchy subject based on, maybe the values that someone grew up with, and now trying to navigate this issue, especially in a culturally
Hmm.
competent way.
Yeah, yeah. So one, I give space for women to share what their cultural values are and what it is that they are struggling with as it relates to what's happening in the bedroom. Um, and then from there, we can kind of tailor certain things. Like for some women, masturbation is just not something that they are willing, able, want to culturally feel is appropriate. Okay, well, then let's have just touching sessions with your partner where sex is not on the table, but your partner is exploring your body, you're exploring your partner's body separately. Like we have to have some parameters. So sex is off the table. One night is one person, one night is the other person. So it doesn't feel like it's this tit for tat thing that has its own issues that can bring up. But being able to tailor some of the activities so that it still gets the job done without causing that tension to be there because of the cultural concerns or the cultural implications.
Besides, like you've mentioned menopause like multiple times, and that is it is a hot button topic where people talk to us often about their libido. But another big issue that we see regularly is, that 6 week appointment postpartum, right? And you're like, go be free. You're given permission to go have intercourse again. And what I usually tell people is I say use lots of lubrication, right? Because so many patients don't use lubrication at all. And I'm like, your tissue is dry. It's not smaller, it's not bigger, it's drier, right? And then I'll say, you may experience pain. You're not the same person. And there are resources for you out there uh, to help address that. But like, what do you tell people? Because I'm sure there's like way more to it than that. What do you tell people when you see them about that period postpartum?
Mhm.
Like, what is the counseling that you typically will give somebody?
Um, well, definitely about the lube. Please and thank you. Get you some lube. That's gonna be your best friend. Get you some lube. But I actually start by telling them go slowly. The first time you don't have to have sex. Like if you can just hold each other, touch each other, because what tends to happen, what I've seen happen a lot, is that you have a baby and it feels like you're constantly giving of your body to somebody else. And then for somebody else to be like, hey, I want to have sex with you, it feels like you're giving of your body some more. And you're like, I don't want to do that. That doesn't feel pleasurable for me. So to get into a space and a place of just being comfortable, being held, being touched non sexually, then moving to the space of, okay, let's do some foreplay. Um, one, for the lubrication factor, for sure. But two, we know that it takes at least 12 to 17 minutes or so of foreplay for a woman to actually have a pleasurable experience with sex and to orgasm. So we want to increase the chances that when you do engage in sex, that it's going to be a pleasurable experience, and we can hopefully close the orgasm gap between men and women and give you some more positive feedback, some more positive neural connections connected with sex. But a lot of times, too, women, they do feel like their bodies are different, their bodies have changed. And it's like, yeah, they have. And guess what? You've just been through an amazing process. Your body's amazing. Embrace that.
I love that mantra, close the gap. Yes, I think
Mm-hmm.
definitely be preaching that. And I feel like to kind of get there, women oftentimes need to feel empowered to kind of, you know, be able to reestablish that sexual connection, or maybe, you know, it hasn't been there before. So how do you empower them to like actively participate and manage their sexual health, especially after pregnancy?
Well, one, just giving them the information about what to expect. Like you said, Dr. Kamisha, it's going to be a little different because you've had a baby. The tissues are not the same at this point. So, anticipation of these things, and here's what you can do about it so that it's not this big shock. And it's like, oh my God, that hurts. I can't do it ever. And then you build up these walls of, I can't do it. It's not working for me. But two, also giving them the permission to say no, that I'm not in the mood right now, to be able to discern whether or not you're in the mood. And this is not even for women who are postpartum, just in general. Like I said, a lot of women who struggle with low libido are in the habit of saying no. Like it's knee jerk. Like, no, I don't want to do it. Nope, I can't do it. And it's like, okay, can you take a step back? Can you pause and really look at, okay, do I want to do this or not? And if it's a real like no, then so be it. It's a real no. But sometimes you're actually in a more neutral state than you think. And it's like, okay, well, what do I need to get to a yes? Is there anything that I need to, that I can do or that my partner can do to get me to a yes? And then obviously, if it's a yes, let's go, close the door, lock the door, let's go, then you know that. But giving the permission to check in with yourself and know what it is that you actually want in that moment.
We've talked about mental health and the important role, like our mental health and our mental well being influences that sex drive, influences that desire. Can you talk a little bit how you navigate that? Like, what if someone is on like an antidepressant, or maybe needs to be on an antidepressant? Like, are there some that you would recommend people pursue versus others? Like, how do you navigate,
Mm-hmm.
anxiety, depression, low libido? How do you navigate that space?
Well, I think one, just trying to figure out if it's the antidepressant causing the low libido or if it's been there beforehand and it's exacerbating it, because that's a different conversation, so to speak. If it seems like it's just the medication, there are certain supplements that you can take to help to overcome that. You can add other medications that help to ameliorate those symptoms. You can switch antidepressants, if it comes to that. For some people, it does come to that. Um, but for some people, they are stable on their medication, and it's like, I don't want to play around. It took a minute to get here to this right dose, to the right medication. So then we do the other things. So what I think of when I think of the medication piece is more of the physical piece, but we address the mental piece of it. We address the emotional piece. We address the spiritual piece of what it means to be a sexual being and what that looks like for you and what would make you most satisfied in that aspect. So it kind of depends, like I said, on which came first. But for the most part, when I work with my clients, it's a holistic approach. Like it's not just, oh, I'm having pain, this is what's going on. Okay, we're going to deal with the pain, and let's deal with the other things that may be influencing, because sometimes it's not the pain that starts the libido issue, it's the libido issue that doesn't get dealt with. And then the body's like, excuse me, hi, I said I don't like this. And then it starts having giving you pain, and then you're like, okay, well, I need to get the pain dealt with. It's like, yes, you do, and we got to get to the root cause of what's happening.
I think, what this whole interview has really emphasized is that the sexual health response for women is multifaceted. It has a lot of components that kind of go into it. Um, one question that I often get from patients, right? There's Viagra for men. What, if anything, is there for women for our sexual
Mm-hmm.
health?
Well, you're right. For women, it is very much a multifactorial thing. It's a little different for men because they tend to have a structural issue, and that structural issue is not enough blood flow going to the penis. So, Viagra solves that issue. There's not enough blood flow going to the penis. We get more blood flow. You can have an erection. You're fine. For women, it may be a blood flow issue, especially with menopausal women. You get a little less blood flow to the genital area, which leads to less lubrication, which can make sex more uncomfortable. It also can cause issues with um, underwhelming orgasms. I'll say it that way. So it either takes a lot more stimulation effort to get to an orgasm, and then once you get there, it's still not the fireworks and explosions like you used to have. It's not doing, the orgasm is not orgasming for you, so to speak. And so what what happens with women is so multifactorial that it's difficult to give one shot of something and it do the job. I think a lot of things that are available and a lot of things that women go for, in terms of treatments, I think there's a bigger placebo effect with a lot of it, because it's like, I want this to work, I need this to work. Um, but I've had patients who've had like pellet therapy and they're getting testosterone or whatever, and they're like, it was working for a little bit, but now it's not working anymore, and I'm back to where I was. So that tells me that yes, there can be a physical component. There is definitely a placebo effect, which we can't discount, but that sex and pleasure is more complex than we think it is. And it's not just as simple as, here, take this pill and you'll be fine.
Now that you've been on this journey and you've like gained all this knowledge, what would you, if you could like talk to your 26-year-old self or your daughter or your friends and your family, what do you tell them? And what's the best piece of advice that you would give them? And what are some resources that you feel like all of us should kind of be utilizing that maybe we're not?
Hmm. I think if I were to talk to my 26-year-old self, I would tell me to be me, be me, and really embrace that, even though it feels uncomfortable. Let my yes be my yes and my no be my no, and not do things to please other people, especially in that arena. But what really think about what it is that I want and go for that. And I think that having that confidence to be able to do that is sexy. Like when I think about the definition of sexy, that to me is when you are comfortable in your own skin and you know you can handle whatever is coming your way. no matter what it is. And it took me to 30 something to get to that space of, okay, I can navigate this, and I can say no and it be okay. Because a lot of times we don't feel like we can say no.
Strong words that literally gave me chills. So I appreciate you sharing that. Is there anything else that you want to share with the Birth Squad? And also, how can our listeners connect with you?
Well, I think the biggest thing that I work towards is helping women to understand that sex and pleasure is important for your whole life, not just this compartmentalized part of, oh, okay, I'm going to have sex now. Like, there's so many implications. Like, your sexual energy is actually not just sexual energy, it's creative energy, it's problem solving energy. So if you are having great sex, that opens you up to accessing that energy and using it to forward your life, your career. They did a study, I think it came out at the beginning of the pandemic, and it said leaders, women, female leaders who were having good sex were actually seen as better leaders, better problem solvers, more creative thinkers, and they were more likely to get raises or promotions. So it's not a frivolous thing that if you are having issues with sex, it's not just affecting what's happening in your bedroom in your relationship. It's affecting your pocketbook. It's affecting your money and your perception at work. So we need to get it fixed. We need to get it right. Um, and then how people can reach me, you can go to my website, Dr. Brandye MD. So it's DrBrandye.com. So my website's there. You can also grab my book off of Amazon. It's called My Oh My, A Committed Woman's Guide to Getting the Great Sex She Deserves. And it's a quick read. And again, ain't nobody got time for that. So you can read this book in like 2 hours and get your life. Okay. So you get the book. Um, yeah, that's probably the two easiest ways. I do have an Instagram, not on the Instagram as often as I'd like to be, but I do have an Instagram. It's dr.brandymd on Instagram.
Thank you so much. Like, I didn't even want to stop because you just kept dropping so much knowledge on us. And it's such an important topic. Like, I can't even express how many conversations I have with friends and family who are like just not thriving sexually and not enjoying their sex life. So, thank you for sharing how important it is. And we're going to bring sexy back, okay?
Yes. And
Right.
close the gap.
Let's bring sexy back.
We're going to close that orgasm gap. Yes.
Close that gap. Yes.
Well, thank you so much for joining the Birth Squad. We really appreciate you being here and sharing all of your knowledge with our listeners.
Thank you. Thank you for having me. This is my jam. So whenever I get to talk about it, I'm super excited and so happy that I can share what I know, because I want every woman who wants to be able to have an orgasm on this planet to be able to have that orgasm and more.
Amen.
So, yeah, thank you. Thank you for the platform to be able to chat.
Thank you. That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram @The Birth Squad, and check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Obwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.